All right, the hip deltoid. And you're probably like, well, what did he just say? Yes, the hip kind of has a deltoid. So the deltoid, for us that don't know, is the muscle that covers the shoulder. But it's also kind of the same thing that happens in the hip, because in the deltoid of the shoulder, we have the anterior, the lateral, and the posterior. And in the hip, see if I can grab some colorful stuff here so it makes maybe a bit more sense. We have also, I hope my hands also look good here. Maybe this side makes more sense. Let's see here. It's going as I'm doing here. I'll use both. We've got the major gluteus maximus, so that is the butt as we know it, and that's basically connecting from the sacrum area here. I always want to take that thing out. Going all along this iliac crest, and everything connects to the leg. And then underneath it, we have another one that comes like this, connects all the way to this iliac crest also, and then connects to the leg. And then we've got something called the TFL, so it's the tensor fascia lata. I always say it like a coffee. And that's connecting from the anterior portion and kind of going into your IT band. That is the hip deltoid. And when this bad boy gets tight, this thing right here in the next video, I don't remember the order of these, unfortunately, because if I've already gone over the thoracic lumbar fascia, then this is going to totally make sense. Or when you watch the thoracic lumbar fascia video, I'm going to talk about, I spoke about this again, and you're going to realize how these can work together and make your life beautiful, or they can make it hell. Because as this starts to really get tight, this hip deltoid, right, the glutes, the Po, as wir sagen in Deutsch, as we say in German. And when it really gets tight, it's gonna trap these hips down. It's gonna really put a lot of pressure on the sacrum, and on both sides, of course. And then you're gonna wonder, God, why am I not able to move? Well, you're not really able to move because it's really trapping this area down. And then you've got that thoracic lumbar fascia I've spoken or will speak about, that's also right here, that's getting super tight. And with all of this stuff all jacked up, jammed up, not allowing you to move, it totally makes sense why we have so much pain in this area, because you basically got a bunch of bodybuilders holding you down, the tight muscles, and you're just trying to stand up and walk around like nothing's going on.